Hi, my name is Cyndi Evans, and I am delighted to share with you my thoughts on an article focused on clinicians' understanding and applications of the skills of knowledge translation of research findings into clinical care for the delivery of high-value, effective healthcare. I recently completed my master's degree in nursing and have practiced in the field of critical care for over 21 years. I would like to thank the JBI for allowing me the opportunity to share my commentary on the manuscript titled, "It Seems Like Common Sense Now, Experiences of Allied Health Clinicians Participating in a Knowledge Translation Telementoring Program" by Dr. Shelley Ann Wilkinson, PhD, and the colleagues from the University of Queensland Faculty of Health and Behavioral Sciences in Brisbane, Australia. Telementoring is mentoring that is carried out at a distance, usually online, when face-to-face monitoring is not possible. The manuscript evaluated 9 allied health professionals' experience with implementation of knowledge translation in their clinical areas with the support of telementoring. The authors posed the question of whether telementoring could be used to provide training and support to all areas and people interested in learning more about this. The theme that appeared at the onset of this project was that many clinicians lacked confidence and capacity to undertake knowledge translation. In general, efforts to achieve the application of research into clinical practice typically involves guest lectures, short courses, or even organization-based courses about evidence-based care and its translation into practice. However, despite these efforts, they are often limited in availability, and they typically occur at university-based healthcare institutions and in major metropolitan locations. This limits availability and accessibility to those in rural areas with fewer resources. 4 projects and 9 participants were selected. These occurred at both metropolitan and non-metropolitan sites. 6 participants successfully completed interviews and were able to share enablers, barriers, and ideas for improvement with researchers. Some of the knowledge gaps that were identified with the implementation of this idea was organizational support, motivation, preparation, and having local champions to continue to build support. A bigger finding was the identified need for support, and what really needed was peer modeling strategy. The value of telementoring was seen, but overall day-to-day support for full adherence over the long term was still needed, and peer modeling methods of promotion needed a structured approach and an organizational support involvement. I was not familiar at all with the term knowledge translation. However, it was clear to me that I was not alone in my lack of familiarity. Decision makers, including clinicians, managers, policymakers, have professed that they are unfamiliar with or confused about this concept of knowledge translation, which may be why it is not widely practiced. And I utilized one of their citations to look up and learn about this concept. In one of those citations, the article called "Exploring Mentorship as a Strategy to Build Capacity for Knowledge Translation Research and Practice, a Scope Systemic Review" by Dr. Anna R. Gagliardia, does an excellent job at explaining knowledge translation. What I did learn was that the knowledge translation refers to the approach for improving healthcare and outcomes. It's through this process that we ultimately use evidence-based practice implementation strategies and improve care. The sharing of ideas is the knowledge translation. Throughout my career, we have used knowledge translation approach many times, and bridging this to the forum of telementoring has already been used in many formats here in the United States. Kaiser Permanente has an educational platform called HealthStream for online learning for staff, and they utilize this type of learning. Knowledge translation builds upon foundational concepts. It engages in cognitive learning processes. It's all presented in a modality of learning that builds on each part, and at the end, it tests comprehension. I believe the use of telementoring programs for knowledge translation in any type of educational opportunity where rural access is a hindrance is a great idea. This manuscript shared the experiences of several healthcare professionals and highlighted areas where complex learning dynamic needs, support, and peer mentorship to further their project success. Furthermore, it would be essential for healthcare organizations to invest in these vital programs and provide commitment to create a culture of mentorship and getting research into practice every day. It is my experience as a member of the American Association of Critical Care Nurses. This virtual telementoring and work towards knowledge translation is very active. This organization provides teaching and coursework online that is then translated into clinical practice at the bedside with preceptorships. Through my 21 years as a bedside critical care nurse, there are a multitude of opportunities that enhance my learning concepts that were done using mentorship. My current addition to practice has been in the field of vascular access. Our team has dramatically reduced central line associated bloodstream infections to 0 for over 2 years now. Many opportunities for sharing ideas through the remote telementoring forum could allow other facilities to learn and possibly implement in their facility our best practices and subject matter expertise. Healthcare institutions in America have internet access, and this would all be needed to begin a universal sharing of ideas to improve the healthcare for every American with the need for vascular access while hospitalized. What if sharing our practices eliminated unnecessary hospital-acquired infections? We owe it to our patients to push forward and learn modalities of care that offer safer outcomes. Using knowledge translation and telementoring processes is the start of a new opportunity. Thank you so much for the opportunity to share my commentary and to learn from the efforts of this research. Thank you to Dr. Wilkinson and colleagues for their continued efforts to further education, mentorship, and enhance the application of research into clinical care. I would also like to thank Elizabeth Scruth, Regional Director of Clinical Quality Programs, Vanessa Martinez as Director of Virtual Nursing Care, and Bronwyn Cox for their support and guidance. Thank you.